Good day to the viewing and the listening public. This is the COVID-19 update for Friday, April 30, 2021. I am Godfrey Brooms, and with me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's always a pleasure having you here. Starting the program off as we usually do, could you state what is the progression of the vaccination campaign in terms of the numbers of persons fully vaccinated and those that would have received the first dose of the vaccine?
Well, thank you very much for the question. As of yesterday, persons who have received their first dose would have numbered 136,152 persons. When we look at the regions themselves, we see that on average Region 6 is doing a little bit better and Region 10 is lagging behind. So we'll have to do some more work in 10 to try to get more people taking the vaccines in 10. Persons who have received their second dose would have been about 4,675 persons. So it's progressing well, but we'd like to see more people come forward and to take their vaccines.
Minister, with the large number of persons vaccinated, is the country in need of more vaccines at the moment?
No, we have enough vaccines, and as I keep saying, we have been able to purchase vaccines to be able to give to our adult population. And so there isn't a shortage. What we want is people to come forward and get the vaccine. So we are encouraging everyone who is 18 years and above to make sure they come out and get their vaccines.
Thank you, Minister. Would stiffer fines be considered as a method to ensure masks are worn in the public and to decrease the activities going on beyond the curfew hours?
Well, the President has expressed in his last press conference that those businesses who continue to violate the regulation, that it's not going to be the bartenders and so who would, or the patrons who are not complying, but it's also going to be penalties on the businesses themselves and the business owners. So we are hoping that by introducing these additional measures, so to speak, that we'll get more compliance. Because again, all of us are in this thing together. So if you have one place that is violating the rules and creating the conditions for the spread of the virus, then it endangers everyone else. And that is why we have to make sure that people are compliant.
Minister, is it advisable for persons to wear masks whilst exercising, especially in public parks?
In public parks, if there are no one nearby and if you have suitable distancing, then I suppose we can allow that. However, the conditions are that most times when people are in the parks, it's really crowded. And if you're walking or jogging, you would be passing people, and the distances might not be that far away. So it is advisable that you wear a mask, all right? So, because again, it's the same principle. It's a basic principle, and that is if you are within a certain distance, within 6 feet of another person, then the possibility of droplets, the person talking to you, you can have these droplets coming out. And if that person is positive and you don't have on a mask, the chances are that you can get infected. So that's the principle really, and the mask acts as a barrier to prevent that infection from getting to you. So in whatever environment, if you apply that principle that you want to protect yourself, then you can adapt that to various circumstances and conditions. In places like the parks and so, because transmission does not only occur because of droplets, but it also occurs because of smaller particles called aerosols. aerosols would have a greater impact and an effect in indoor environments. They wouldn't have so much of an effect in the outdoors because one would, you know, allow for movement of the air and things like that. So aerosols probably would rapidly dissipate. But with droplets, there is still a problem in an outdoor environment.
Thank you, Minister. There are a lot of myths going around about the COVID vaccines, one of which says that the AstraZeneca vaccine will turn persons who take it into monkeys. Can you respond to this, Minister?
Well, millions of people around the world have received the AstraZeneca vaccine, and we haven't had any case of anybody being turned into a monkey. I mean, we've had here more than 40 or 50,000 people, I would say, 50,000 in Guyana, at least, who have received their first dose AstraZeneca. We don't have any case of anyone turning into a monkey because they received the first dose. I mean, the things that people are peddling is so ridiculous that sometimes you don't know whether to respond to it or not. But if people can just take a moment and think about what is being said and what is the reality, then you know that this thing is patently false. So in the case of the AstraZeneca vaccine, look at the examples here in Guyana. More than 50,000 people would have received that vaccine. Nothing is wrong with them, right? They're going about their business, they're doing their work. Nothing is, they haven't turned into any monkey. And around the world, millions and millions of people have received these doses. There's nothing wrong with them. So again, as you have termed it, it's a myth, and we have to make sure that people understand the facts. And the facts are that, this does not affect people in any way. It would help to protect you and protect you from getting the disease.
And Minister, another popular one says the virus mutates so fast that a vaccine will never work. Your response?
Indeed, the virus has mutated, and we know this because there are various variants that are circulating. We know that from the beginning, the original virus has mutated several times, and different variants at different point in time would become dominant, the dominant strain that is circulating. Right now, we know of a UK variant that was discovered in the UK, the B117 variant that has been discovered in South Africa, and one that has been discovered in Brazil. We saw these emerging late last year, and they have become more or less dominant strains in a number of countries. We now have a new wave, so to speak, of variants. We have seen a new one emerging in India, and we have had variants that are in the US, variants that are in the Philippines. So it emerges, but as it emerges, because many of the countries are doing gene sequencing, we are able to detect what are the changes in the genome of the virus. And having been able to determine that, then you can check to see how this new variant behaves. Now, typically, we would see maybe it would increase transmissibility, meaning that it can move more easily from one person to another. The other thing is that in some cases there can be a severity of disease. It increases the severity. And those things are being checked for and looked for. And one of the things that is also being checked is to see how the current set of vaccines would react to different variants. And so far, with the clinical studies that have been done, most of the vaccines are still effective against the different variants that are coming up. But as you can imagine, as a variant emerges, you will have to go and set up those experiments to test and to see whether the vaccines are really working. But this is ongoing work, and it would continue. The scientists, the researchers are constantly doing these evaluations. And from those evaluations, we are able to adjust how we do the science in real life.
Thank you very much, Minister. I'll now hand over to my colleague, Tamika Rodney from HGP Nightly News, who will pose a few questions.
Minister, the CDC recently announced that persons who are fully vaccinated are no longer required to wear masks when outdoors in small groups. Can you say if this is a measure we can possibly adopt later on once we have a certain amount of persons vaccinated?
Well, the circumstances in the United States is a little bit different because you have more than 200 million persons who would have already received their vaccines. And so because of that number, they are now trying to soften some of the measures that they have. So what the CDC guidance is really speaking to, amongst vaccinated people, if you're all vaccinated, then you can reduce some of those measures like masking and so forth. But again, in our context, because there are so many people who have not yet taken their vaccines, we are not at that level where we can safely, drop some of these measures. And so if we work hard enough and we get more people to take the vaccine, we would get to a point where we can remove those measures. But as of now, we have to maintain them and continue using them. Israel, for example, which is one of the first countries that would have gotten close to herd immunity, they have removed masking because most of their population would have already gotten the vaccine. So they're showing what is possible. And if we work hard enough and make sure that everyone here, adults, receive their vaccine, then some of those measures we can remove them.
Understood. Can you say what percentage of the active cases right now are asymptomatic?
Well, look at it this way. We have about 1,800 active cases, and we have 61 persons who are in the hospital. So those who are in hospital would be the persons with moderate to severe illness. So you can do the calculation. The rest would be more or less asymptomatic or mildly symptomatic.
Yesterday, you mentioned that persons exhibiting COVID-19 related symptoms should not access the vaccines. However, we do have persons who do not exhibit any symptoms and are COVID-19 positive. What's the worst that can happen if an asymptomatic person accesses one of the vaccines?
So the WHO guidance is that you shouldn't make testing a requirement before someone get a vaccine, right? So that's the guidance. And in our context, we are not going to test anyone before we give them the vaccine. If someone is symptomatic, then by using the questionnaire that we have, we'll be able to find that out and we'll advise them accordingly. If you are mildly symptomatic, then we would be able to use that questionnaire, ask you to wait until you recover. Generally, that would take 10 days. And having completed your recovery period, then you can come and get the vaccine. There was a guidance previously that speaks to if you were previously positive, that you wait for 3 months before receiving the vaccine. That guidance was based solely on vaccine scarcity around the globe. So when WHO had advised that you should wait for the 3 months, It's really because persons who would have been infected would have antibodies circulating in their system for at least 3 months, and therefore give another person a chance to get the vaccine. We don't have that kind of restriction because we have enough vaccines for people, and so we have changed that a little bit to allow for persons who have recovered immediately after they're recovered, or we consider them recovered, that they can come and they'll be eligible to receive that vaccine. So our things are a little bit different from what is advised. And in terms of mild, or well, not mild, but asymptomatic cases, most of those asymptomatic persons themselves would not know that they have COVID. And that's because they're asymptomatic. They have no signs, no symptoms of anything. So if they don't do a test, nobody would know. If they come, they would tell you that they don't have anything because they are unaware. And in such circumstances, we'll give the vaccine. There's no harm in them receiving the vaccine.
Final question. Internationally, we're seeing that persons are not accessing the booster doses for these vaccines. Can you expound on the importance of the second dose?
Yeah. So the first dose would start working on your immune system, and after 21 days after the first dose, most people would have antibodies circulating. These antibodies are important to detect if you're exposed to the COVID virus. They'll be able to detect it and work very quickly to get rid of it. But after a certain time, these antibodies start waning in your body. And that's a natural way of how our immune system works. So what you do when you get a second dose is that you further boost your immune system. And so the memory that your body would have would be far greater. And the immunity that you develop would last longer. And in many cases, the efficacy that you would develop for that, using that particular vaccine, goes up, right? So if you only use first dose is going to get you at a certain level, but if you add a booster, then it goes higher and you're even more protected. So it's important that you come back for your second dose. So far, what we have noticed, people are coming back. As the second dose gets due and they're looking at their card, most people are coming back and they're getting that second dose. As I said before, we've had 4,675 persons who have already received their second dose. And again, after the second dose, you wait for about 7 days, and then you're considered to be fully immunized or fully vaccinated. All right? So, again, we have to encourage people. We have quite a lot of people who already received their first dose, 136,152, and I'm sure they'll come back to get their second dose. Because when you come to take the vaccine, the nurses, the healthcare workers who are at the vaccination site would also emphasize the importance of why you need to get that second dose.
This has been the COVID-19 update with the Minister of Health, the Honorable Dr. Frank Anthony. For more information, you can visit our website at dpi.gov.gy or our social media platforms. Godfrey Brooms is saying goodbye for now.